Is getting sick as an older expat in the Philippines an automatic death sentence like some fear? Well, not exactly, but you do need to be aware of a few very important considerations before packing your bags and coming here. We will talk about that today on Escape to the Philippines. Class is in session. The internet is cluttered with stories of down-on-their-luck expats who are destitute, sick, or even dying in the Philippines. But does that paint the true picture of life and death in this country? Probably not, but if you ask me, there are places in the world I would certainly rather be if I suddenly became seriously ill. The U.S. spends significantly more on health care than any other developed country in the world. In fact, according to the 2021 figures cited by WorldPopulationReview.com, the U.S. spends at least 40% more on health care than any other country in the world. To be specific, the U.S. spent $12,555 per person on health care, easily outpacing second place Switzerland at $8,049. Still, the patient outcomes in the United States are not significantly different from those in other developed nations. Just take a look at the healthcare index as reported by Statistica.com, and you will see that the Philippines ranks number 96 out of 167 countries. That's not great. However, the U.S. ranks only 69th on the list, behind Armenia and 2 behind Jamaica. Yeah, man. So neither country has any right to brag. One of my viewers commented recently that in his experience, doctors and hospitals and even emergency room personnel were inept and uncaring. Last week, I went to the hospital emergency room with a back issue. The facility was crowded and busy with narrow hallways and not the latest of equipment. But in my opinion, the staff did an adequate job of caring for me. I was able to get a CT scan on my back, and an MRI machine was available if I hadn't already had a titanium appliance fusing my spine, which made that test unwise. Although I have not had the same experience as my viewer did, I can understand why anyone might think that. Let's look at it this way. The average physician's pay in the Philippines is 49,829 pesos per month as of January this year. In the United States, the average physician's monthly base salary is $21,000. So, why wouldn't the best and brightest come to the United States to get their share of the pie? I don't want to disparage healthcare workers in the Philippines. In fact, the Philippines is known the world over for producing the world's best and most caring nurses, and the doctors don't seem to be far behind. Families, including 2 that I know personally in just the past 6 months, proudly have daughters in college nursing degree programs. Those families are hoping to see them get jobs in the West and send some of that more lucrative pay back to the Philippines. And I can't blame them. I think some of the problem is in Filipinos' attitude toward health care in general. I have been told point blank that Filipinos will not go to a doctor unless they are sick. Few think of getting an annual checkup or even diagnostic lab work done to make sure there are no problems looming on the horizon. Without that diagnostic lab information, and with a diet where, as they say, rice is life, problems can suddenly appear. Hello, diabetes! Back in the United States, I would just go to my family primary care physician, have my annual paid-for checkup, and get an order for my annual lab work. That lab work, after the insurance has paid its share, is about the same as what I pay in the Philippines out of pocket. But insurance companies in the U.S. are a hassle. In my last U.S. experience, my primary care physician referred me to an orthopedic doctor who then in turn referred me to a pain specialist, who was his own wife, to get a steroid shot. Still, the insurance company would not take the word of the orthopedic doctor and then required the pain specialist, the third physician in this three-ring circus, to schedule an initial consultation before paying anything toward an injection that ultimately cost me $347 out of pocket. Heck, my entire emergency room visit last week, including consultation, the CT scan, and urinalysis, cost me much less than that, coming around $250. Dentists here in the Philippines seem to do more extractions than fillings, crowns, root canals, or dentures, and it shows in the many toothless smiles around me. I can't understand that because my dental cleaning last year cost me less than $8 US, and my recent doctor's clinic visit was less than $10. My good neighbor and friend, who soon will be traveling to join my best friend in the United States on her K-1 fiancé visa, recently went to the dentist for the first time in her life to have a wobbling tooth extracted and a partial denture installed so she would be sure to pass the requisite medical exam. Of course, insurance, or at the very least a healthy savings account that will allow you to self-insure, are crucial in the case of major issues to prevent total financial catastrophe. Philippines hospitals, although relatively inexpensive compared to their American counterparts, expect to be paid before you leave, and I hear complaints that it is somewhat akin to being held hostage. So what is the answer for expats who want to take care of our health and have a little peace of mind as we grow older? First, live a healthy lifestyle. Rice 3 times a day is not your best friend. And a healthy lifestyle is not constantly sitting around in a beer bar. Second, if at all possible, live somewhere near a large city. Manila is one of the world's largest cities and has some of the better medical facilities around. I personally would not want to become ill far out in a mountainous province without access to a decent hospital, and in many instances, not even an ambulance to take me to one. Past that, the answer might lie in medical tourism. Although it is an extremely expensive place to live and stay, Singapore is the #1 country in that World Healthcare Index, and just a 3.5-hour flight from Manila. Thailand, also relatively close, ranks 31st on the aforementioned index, and Malaysia, another neighbor to the Philippines, is 43rd. I have had one friend go to Thailand to get his 100,000-mile checkup, to put things in automotive terms, and he was very satisfied with the treatment he received. Another friend had a tumorous kidney removed a few months ago at a private hospital about an hour outside of Manila, and he has come out of it just fine. So, as that friend has told me several times, the way things work in the Philippines is that it's not right, it's not wrong, it's just different. You just have to live the healthiest lifestyle and make the best decisions you can for yourself. I'm happy so far with both the care I've received and the cost of it in the Philippines. But I haven't given up my Medicare Advantage plan either, just in case I have to rush back to the U.S. to use it. Class is dismissed.